As Vikram and Sandeep mentioned, I've been on dialysis for the last 17 years. I work full time, I swim every morning, I travel regularly, I pretty much lead a normal life. Currently in India, unfortunately, there is a big misconception among the public at large that when somebody is put on dialysis, it's pretty much the end of life. That this patient will have another 6 months to 1 year to live, and then he's going to die. That's the general misconception among a vast majority of our population today. Fortunately, that's not true, and I am a living example. I've been on dialysis for the last 17 years, and I intend to go on for much longer. We want to basically give this message to all the dialysis patients in the country that dialysis does not mean the end of life. Despite coming on to dialysis, people can lead a normal life. You need quality dialysis, you need frequent dialysis, and you need long duration dialysis. This is the high level message that we want to bring to every single dialysis patient in the country. So to that end, one major problem that dialysis units face in the country, which is a huge cause of death in dialysis, is cross infections. When patients come to a dialysis center for dialysis, for treatment for their kidney problem, they are cross infected with viruses such as HIV, hepatitis B and hepatitis C. And those diseases are much worse than kidney disease itself, which is a criminal thing that's happening in all our dialysis centers in India until we came in. In our dialysis centers, we have introduced some processes because of which we have totally eliminated cross infection. For example, the zero infection point kit. Then there is a 56-step dialysis process. These are our own inventions, Nephroplus inventions, which prevent cross infections, which don't allow patients to get infected with hepatitis C, hepatitis B and HIV. And that is a huge relief for dialysis patients because they are getting saved from such dirty diseases which are worse than kidney disease itself. The third thing is Nephroplus Dialysis Index. There is a concept called adequacy. If many hospitals in the country do dialysis for patients, for a lot of patients come, get dialysis and go. However, their quality of life does not improve. That is because the quality of dialysis is bad. The dialysis that is being given is not enough to clear the blood completely. So to first of all measure the adequacy and then to improve the adequacy, we've introduced the Good Dialysis Index, the Nephroplus Dialysis Index, which is an adaptation of an Australian index of Dr. John Agar, and we've customized it to the Indian needs. And we've started tracking that index and then acting on the index. It's important to act on problems. Usually people don't even measure this in the country. So forget about acting on the problem. We also want to make dialysis totally convenient. Like dialysis is a huge hassle. When people come for dialysis, those 4 hours can be very frustrating. There are a lot of other problems as well. So we looked at all the problems that a patient has on dialysis. I've been on dialysis for so many years. I know what the patient goes through. So based on my experience, plus talking to other patients, talking to doctors, talking to the technicians and nurses, we brainstormed a lot and came up with unique ideas which basically introduce process innovations in the dialysis experience for the patient. So for example, we have pick up and drop. Like a lot of dialysis patients have to come with a family member, and almost the entire day goes for both people. So what we said is, why should the family member have to go through this? Just we'll pick up and drop the patient ourselves. That reduces the family member from wasting a lot of time every second day on dialysis. Medicine management is another thing where we manage pill boxes for the patient and give them, because some patients they forget which medicines they need to take. So based on the prescription, we manage the pill box and give it to the patient at the beginning of the week. That whole week they take medications as per that pill box. Microcare for guests. A lot of patients, we call our patients guests. That is one big attitudinal change that we have introduced to the dialysis community in India. Patients should not feel that they are patients, that they are sick. Because when you're on dialysis, you don't need to feel sick. You can do everything that you want to do. It's just a matter of getting quality dialysis and good dialysis. So every patient is different. What we do is we identify each patient's specific preferences about different things, about simple things. And then we call that microcare, where every guest who comes to an Nephroplus center is treated personally based on his or her individual preference. The worst thing about dialysis, if you ask me, is the needles. 2 thick needles are inserted into your arm, one for drawing the blood and one for returning the blood. That needle is very, very painful. That is the biggest fear that patients have on dialysis. There is an innovation that was introduced in the US called the Buttonhole Needles, which are basically blunt needles that reduce the pain by almost 90-95%. We are the first and the only dialysis provider in the country today who provide buttonhole needles to all our guests. So with that, dramatic amount of fear is totally eliminated during dialysis. People, our patients who have started using that, they just love this so much that they really are totally attached to it and they will never go away from it anymore, because that is the biggest fear a dialysis patient has about the treatment itself. Home hemodialysis, around the world, home hemodialysis, the prevalence of home hemodialysis is going up, where patients don't need to come to a center or a hospital to get dialysis. The dialysis unit is set up in their houses and they do dialysis there. This also improves outcome, quality of life and overall longevity of life as well. We are the first people to introduce home hemodialysis in the country today. Holiday dialysis. A lot of dialysis patients, they get very depressed and they feel scared about going for holidays. But I mean, as a dialysis patient, I love to go on holidays. But why should our other dialysis patients be deprived of this whole joy of going on a holiday? So what we said is, let us take out the entire hassle of holiday. Holidays planning, it's a hassle even for normal people, right? Booking your tickets, booking hotels, booking cabs. And here dialysis patients have the dialysis hassle as well. What we said is, you tell us your date, your location, number of people. That's it. That's all you need to tell us. We'll figure out everything. Right from hotel bookings to flight bookings, train bookings, cab bookings, and dialysis bookings at a Nephroplus center, where you're assured of quality dialysis. And then we also believe that we need to track, the satisfaction levels of our guests so that we can take action to improve and find out problem areas and then correct them. So we have quarterly guest satisfaction surveys where, our headquarters, we call all the guests across the network and take their feedback on the important aspects of our service. So at a high level, I want to conclude by saying that our high level goal is to bring quality dialysis to every single dialysis patient in the country. 150 is also not the end of our plans. We want to go to every district in the country at one day, so that there's nobody in India who is deprived of quality dialysis, who is deprived of a long normal life on dialysis. That is the important thing, long normal life. There is no point in extending the lives of dialysis patients if they're just going to sit on the bed the whole day. We want dialysis patients to lead an active, productive and a useful life where they feel that they are not being deprived of anything just by being on dialysis. Dialysis is not the end of life, it is just the beginning of a new life.